Hi guys, in this video we are going to talk about the humerus bone. The humerus bone is the bone which is seen in the arm and it is the longest bone in the upper extremity, and it mainly it mainly have three parts, that is the upper end, a shaft and a lower end. So in this video we are going to talk about the upper end of the humerus. So talking about the upper end, it mainly has three parts, which is a head and two tubercles, that is the greater one. The largest one is the greater and the smallest one is the lesser. Two tubercles and a neck. And first talking about the head. As you can see, head is rounded and it is spherical and it forms about one-third of a sphere. And it is covered by articular cartilage and it articulates with the glenoid cavity of the scapula and forming the shoulder joint, that is the glenohumeral joint. And the next feature is the tubercles. There are mainly two tubercles, that is the greater tubercle and the smaller one is the lesser tubercle. And the greater tubercle is this one. It is mainly facing the lateral aspect. That's if this bone is like this, this portion is the anterior part, this portion is the lateral, and the head always face medially. So it will be the medial part and the back portion will be the posterior part. So it is anterior, lateral, medial and posterior. So we can see that the greater tubercle is facing laterally. So it is seen laterally and it is the largest tubercle, and its importance is that in this posterior aspect, we know that it is lateral and it is posterior. So in the posterior aspect, there are three impressions, that is the upper, middle and lower impressions, and these are the muscle attachments. We will discussing it about in another video. And the next feature is the lesser tubercle. Lesser tubercle is seen, we know that it is anterior, so it is seen anteriorly and it is prominent. You can see it is bulging backward, so it is prominent and it is the lesser one and it also have muscle attachment. And the next one is this smaller area seen in between these two tubercles, is smaller area which is separating the greater and lesser tubercle, and it is called as the intertubercular sulcus or bicipital groove. From the name we know that intertubercular means between the two tubercles and it is a sulcus. So intertubercular sulcus. It has mainly three parts, that is the lateral lip, the medial lip and a floor. The lateral lip is in, we know that the greater tubercle is in laterally. So the lateral lip is the lip that is the downward continuation of the greater tubercle. The lateral lip of the intertubercular sulcus is the downward continuation of the greater tubercle, and the medial lip, which is seen in the side of the lesser tubercle. The medial lip is the downward continuation of the lesser tubercle. So the intertubercular sulcus mainly has three parts, the lateral lip, the medial lip, and the space seen in between is called as the floor of the intertubercular sulcus. The lateral lip, medial lip and floor. These are the main three parts of the intertubercular sulcus. And talking about neck, there are mainly three necks. That is, first one is the anatomical neck. Anatomical neck is the portion that is seen as the periphery of the head. That is, head is rounded, you know. So the periphery of the head is called as the anatomical neck, which is separating the head portion, that is the rounded portion, from the other structures. It is called as anatomical neck. And the next one is the surgical neck. Surgical neck is the constricted area which is separating the upper end from the shaft. The constricted area, it is seen as a line, that if it is a line like this, it is the surgical neck. This neck is the surgical neck, and there is another neck called as morphological neck. If we consider this line as the surgical neck, about 0.5 centimeter, which is about 0.5 centimeter above the surgical neck, we have the morphological neck. The importance of morphological neck is that it is the part which is seen as the epiphyseal line is seen. So mainly three neck, the anatomical neck, the surgical neck, and 0.5 centimeter above the surgical neck there is morphological neck. So these are the main features of the head, main features of the upper end of the humerus, which are the head, two tubercles, intertubercular sulcus, and three necks, that is the anatomical neck, surgical neck and morphological neck. So these are the all things we are discussing in this video. and we will be discussing about the muscle attachment of the upper end in the next video. So if you like my video, consider subscribing my channel. You can get notified about the videos which I am posting. The next video will be about the muscle attachment of the upper end of the humerus. So thank you guys for watching.